Welcome to lesson number 4 of module 3 of the Healing Brain Masterclass, Innovation and Treatments. I'm your host, John Malanka with The Sacred Plant, and in this lesson, we are tackling treatments, the variety of protocols and formulas for patients diagnosed with cognitive decline and their associated symptoms as they relate to dementia. Today, with advances in biotech research and public health education, new tools like brain games and memory villages are coming into the marketplace to enrich the cognitive reserve and help those diagnosed with some form of neurodegenerative disease. In our Sacred Plant community, many are curious about the herbal remedies like turmeric and supplements like ginkgo oil. Join me as I discuss with Dr. Stein his expertise on some of the successful treatment plans he has found to treat cognitive decline and various dementia symptoms associated with Alzheimer's. Welcome back, Dr. Stein.
Thank you.
Always great to see you, and welcome back to the Sacred Plant family. Always great to see you as well, and thank you for being here with us today. We're still on the topic of Alzheimer's, and we just spoke about symptoms. And now we're going to talk about treatment plans. Treatment plans not only in conventional medicine, but also in alternative medicine. Can you share some of your insights on what is working, what's not working in the conventional medicine, what's working and what's not working in the alternative medicine?
When we treat Alzheimer's, we look at two different things. The disease itself, which is progressive and degenerative, and then the symptoms. Oftentimes, we can treat symptoms and have a pretty good success rate, but unfortunately, treating the progression of the disease is very difficult. We have some conventional medical therapy for both. For treating the progression of the disease, the conventional medical therapy is only modestly helpful. There was a study that showed that patients with Alzheimer's disease that were on this therapy did not have to go into a nursing home or assisted care facility as soon as patients that were not being treated with the medication. And the difference was about 1 year.
And what type of medication are you talking about? Cannabis or conventional?
Conventional.
Okay.
Conventional medical therapy can slow the progression rate so that patients being treated with those therapies have about an extra year of independent living, or at least living outside of a facility. So that's something. And when patients come in and they have Alzheimer's and their caregivers and family look at you and want some hope that you can slow down the condition, it's nice to at least have that option, even though it doesn't really work that well. Cannabis therapy, we know in the laboratory, can slow the progression of Alzheimer's type plaques that develop in the brains of laboratory animals. Now, we don't have clinical evidence in humans yet, but there's some very promising laboratory evidence to suggest that the progression of Alzheimer's can be slowed by using THC. We also know that alpha-pinene has been shown to slow some of the progression, and in the laboratory at least, it's very promising.
So I didn't mean to cut you off there. So I know the studies are showing laboratory, and you want the laboratory results. What about your own personal experience? Have you had any personal success with cannabis and your patients?
In terms of slowing progression of the disease, I haven't seen that in my clinic yet. We've only been open about 2 years since Amendment 2 passed in Florida.
That's right.
And in order to see a change in progression, you need at least 2 or 3 years. Because the slope of the decline is slow. And it's hard to see that you're changing the underlying process within a year or two. Sometimes it takes longer to really see the change in the slope. As far as treating symptoms, though, when it comes to treating symptoms, we are seeing success in the cannabis clinic using certain terpenes like myrcene, which is a sedative and helps with agitation and restlessness, helps with sleep. We're also using alpha-pinene, which helps increase the level of alertness and reduce short-term memory problems. So using those two terpenes, myrcene for nighttime and alpha-pinene for daytime, we are seeing some benefits.
And so with these terpenes, I'm certain our followers are thinking, where do I get these terpenes? Is it in the product that they're already purchasing at the dispensary? What if they live in an illegal state, they don't have access to this? Can they just go out and purchase separate terpenes, as we spoke about earlier in the symptoms lesson regarding essential oils? I carry a bottle of lavender in my briefcase, and that's for calming. And so, what can you recommend for our listeners?
If they're living in a legal medical marijuana state, I believe the best way to get those terpenes is as part of the whole plant.
Okay.
So that the other terpenes and the cannabinoids that live in that flower are working together in a way that we may not understand. So nature put those terpenes there with those cannabinoids, and that flower is living and is going to be helpful medicine to us as a whole.
Okay.
So if that's possible, I believe that's the best way to get those medicines.
You know, I haven't been in a dispensary in a while, and on these products, will it say terpene profiles now? I mean, because they weren't showing those in California. They weren't saying 1-to-1 ratio with these terpenes. Are you seeing that here in Florida?
Yes and no.
Okay.
Usually you have to ask for that. On the medication, there'll be a label for almost every dispensary that lists the cannabinoids.
Okay.
You know, CBD, THC, CBG, CBN, all the different cannabinoids. But no, the terpenes are usually not listed on all. But we have a cannabis consultant in our office.
Oh, wonderful.
We have hired someone here to help patients find their medicine. It's difficult, and I don't think most patients have the energy or time to call every single dispensary, find out what each of them is selling at any given point in time, because that changes grow to grow. Yeah. And so Brian, our cannabis consultant, will get with a patient and help them find the product that we hope is best for them.
You know, it's difficult. I think that's a great addition to your office because it is needed. You know, we have patients that call every day saying, help, where do we go? And so I think you having that, you're leading the pack, not only being a neurologist in this industry, but also having a cannabis consultant on staff. You know, it's difficult because one of my last visits in a dispensary, it was in Southern California. I went in there looking for THCA. They we don't know, we don't carry it. And so I said, how do you not carry this? And he really didn't know what it was. And so as I'm taking a look at what everything they have to offer, there's a refrigerator there. And I look, and what is it filled with? THCA. And I said, that's THCA. So not all dispensaries are created equal. So find the ones that are, I guess what? Educated on the products they have in there and what's in their store. I mean, it was kind of embarrassing. I think for both of us, you know, that he was repping he's a representative for that dispensary, calling themselves a medical dispensary, and you know, he didn't know what THCA was, and a lot of times that happens. Not just in Southern California. I've had it up in the San Francisco area. Not a clue what THCA is, but sure enough, it was right there in their counter or in their refrigerator. So don't be afraid to ask. When it comes to terpenes, ask. It's not up to you to go find these terpenes to add them to your medicine. Just as Dr. Stein was saying, you know, a lot of them are being added into the medicine that's there. And just like you would have a nutritional value on your food products, there's a cannabinoid breakdown also on these products. And now with the new laws that have taken place here in Florida, as well as Colorado, I'll say, but in California, you know, new laws with regulations there, it's required to have these labels on the products that you're purchasing.
I believe the market will create a situation that the consumers demand. Yeah. So the vendors, if the consumers speak up and tell the vendors what you want, they'll create it. Okay. You know, supply and demand.
Yeah, and make sure that all your products are tested as well. And I'm a big advocate on having tested, safe products. Again, it's not up to you to do it. It's up to the dispensaries that they're selling the products. And if they don't have it, move on to another dispensary or move on to another product as well. Can you talk about neurotech innovations like brain stimulation, biofeedback, brain games, which we've spoken about in previous lessons?
Well, when it comes to Alzheimer's and other forms of dementia, it's important to stay as active in terms of cognitive function as possible, even though it may be more difficult. So you don't have to do a brain game on the computer. You can just go out to dinner and have a conversation with someone. Remember the pillars.
Good food, good sleep, great exercise. I'm going to say having friends, but we can also add beer in there, but I'll scratch that one. So let's go with the pillars, but good food, good sleep, great exercise, getting out, good conversations that you're talking about with friends and loved ones, but also picking up a new hobby, as we were talking about with the brain game. Doesn't have to be a brain game, but picking up a new hobby. Learn to play piano. A friend of mine's mom had a stroke, and she's now doing well, but she picked up piano, and she does her concert what do you call it? Recitals. And then the 6, we always say the 5 pillars. Let's add a 6 in there. What about cannabis?
As a lifestyle choice, cannabis can, I believe, someday be part of what most people do. Mm-hmm. But the science has to provide the impetus for that. And it's going to be a while before cannabis becomes one of the pillars. But we can talk about it in our clinics with people that trust us. And we can say, sure, cannabis is better than, let's say, alcohol. Yeah. So someone who likes to relax every night after dinner with a cocktail, maybe it would be more healthful to use cannabis as a relaxant instead of the alcohol. You're changing a lifestyle choice. You're making a choice that's now involving cannabis. So much safer than alcohol. Tobacco is another one. Yeah. You know, people use tobacco as a way to relax and as a lifestyle choice. Why not use cannabis? Yeah. Someday I think we'll see.
Good. I think we'll see it shortly. What I've always seen with the patients that we work with Alzheimer's is THCA. And I know you have mentioned quite a few times about THC with your patients. And can you share any stories or successful stories or unsuccessful stories with using one or the other or both?
Well, in our clinic, we are using both.
Okay.
But we don't have the large number of patients with Alzheimer's over a long period of time to watch the effect. Okay. As well as someone like Dr. Hergenrather, who's working at I believe it's the Primrose Assisted Care Facility in California. So he's using THC and THCA, along with CBD and other terpenes, in addition to the cannabinoids, and monitoring these patients over a longer term. So we're looking forward to publication of those results. In our clinic, we have short-term wins with behavior. We have not been able to see much of a change yet in the progression of the disease. We know that THC and THCA reduce the accumulation of amyloid plaques in preclinical laboratory models, and that's great. We need to try and see if that's going to happen in humans. And that will take several years at least of research, careful research. When it comes to treating symptoms, however, we can see more of an immediate benefit, and we can know more quickly whether or not that treatment is having a positive impact.
Also on impact, and I love, again, the small wins. But what about back to nutrition and vitamins and supplements for brain health? Is this something you recommend as well, or are you more so into pharmaceutical and the other alternative medicines?
Proper fluid and nutrition balance is very important, especially in elderly patients who don't pay enough attention to those issues. It seems like a common problem. Yeah. As you get older, you don't drink enough water. It's that simple. Yeah. Sometimes those individuals are drinking too much alcohol as part of their lifestyle choice. They get dehydrated. And one of the most common things we see, not just in the clinic, but in the hospital and emergency room, is dehydration in elderly individuals. Yeah. Someone comes in, they're confused, they're off balance. One of the first things we do is check for dehydration. And you don't have to be in the hospital to check for dehydration. You just have to look at someone's tongue. Or you have to pinch their skin and you can see how much turgor there is, we call it. I had someone in the clinic the other day, and I suspected that she was dehydrated and as a result confused. Yeah. And I'm looking at her tongue, I'm pinching her skin. She's like, "What are you doing to me?" Well, it turned out that her tank was empty. And after 2 or 3 days of concerted rehydration, she came and she was much better. Good. Sometimes it's that simple. Yeah.
But my mom, for dehydrate, for her, she's not a big water drinker. But you know what she drinks? Hot water. All day.
That's fine.
And so, I think that's a great thing for a lot of patients that either...
Right, hot water. My mom, hot water with lemon.
Yeah, same.
They love that.
Totally.
Maybe it's like an older generation.
I think so. But so she stays very hydrated with that. She would, and I'm an ice guy, but she's not, you know. So, but let me have the hot water, and she'll drink that up as well. So we just spoke about supplements. Is there any over-the-counter supplements that you can recommend for myself or our listeners as well?
I do not recommend supplements on a routine basis. I do try to tailor those recommendations for patients that have specific deficiencies.
Okay.
So if they're not eating enough vegetables, we'll recommend a B complex, calcium and so forth, if there's risks of osteoporosis. So we talk about that kind of a thing in a more specific way. But in general, I don't have a specific recommendation.
Like fish oils and ginkgo and stuff like that. Is that something that you...
I think it's okay.
Yeah.
It's not going to harm anyone. I don't feel as a clinician scientist that I can mention or recommend those things without additional evidence. And I know there's some evidence out there, but my personal practice is not to recommend those to everybody.
Okay. What about exercise? Getting them on an exercise routine, because I know that helps me with my mind. Helping with thoughts, but also clearing.
That is good for everyone, no doubt.
Okay.
So yes, we recommend exercise, especially in patients that are getting older. If they can do it, they need to do it. And sometimes I'll go ahead and order physical therapy for people that don't have the motivation to get started on their own. And on the prescription, I'll just say deconditioned. So they're deconditioned, they need to be reconditioned.
Gotcha.
And those patients will go to the physical therapist. They'll learn how to use the machines or get in the pool. They'll get a program. They'll get some incentive, and hopefully they'll get on a program. So that answer is a resounding yes.
What about just minor movement? Just doing something like this, moving your feet, moving your hands, moving your shoulders, taking big breaths. Do you recommend that to patients that aren't able to get out and really go for a 50-mile bike ride like Brian? Is that something that you would recommend to patients as well?
Yes, absolutely. A lot of our patients are sedentary, either as a result of their illness or age, and they can't get to the gym. They can't get to the physical therapist, although I'll have the therapist come to them sometimes.
Good.
To have them work on range of motion.
Yeah.
So that's what we're talking about.
Good.
We're talking about range of motion that'll keep those joints limber. One of my favorites is making circles with your toe.
Totally, yeah.
It's that simple, and that's often enough to improve someone's sense of well-being.
I appreciate that. Before we move on, I would like to talk a little bit about cannabis as well, and tailoring different formulations for different patients and different ailments, most certainly without your Alzheimer's patients. Since cannabis is not a one-size-fits-all, what are you seeing and what are you doing to tailor these formulations for them?
With Alzheimer's, it's important to determine who's going to give the medicine in addition to how much they're going to give.
Okay.
Because we want to have a reliable dosing schedule. It's easy for someone with memory difficulty to make a mistake with their medicines, clearly.
Yeah.
And so if you have a caregiver that's willing or able to specifically dose the medication, we usually start out with a very low THC product, really just 1 or 2 milligrams as a tincture, for example,
Yeah.
or maybe 10 milligrams, which is in a patch that's provided over 2 or 3 days, which is exceedingly small, but it's convenient and unlikely to cause any problems.
Okay.
You don't want to make any problems.
Yeah.
So starting with a very small amount of THC, along with CBD, you need both, and then increase that from once a day to 3 times a day over, let's say, 3 weeks. That's a typical protocol.
Gotcha. I am a fan of those patches, by the way. But I was always told not to put them on your shoulder like you would a Nicoderm patch, but on the inside of your wrist, back of your neck, on your ankles. Are you seeing something different with that? Because I know you pointed to your arm, just to point to your...
So the distribution of the medicine is becoming much better.
Okay.
So when you put a topical medication in a vascular area, like the inside of your wrist, you're going to get that absorbed into the blood vessel and into the circulation much more easily than putting it here on the shoulder. However, the technology of these medications is getting quite good. And so you can now put a patch in an area like the shoulder or the back, and it will get absorbed and the medication will be as effective.
Gotcha. So it's not like an icy hot where you have a sore back or a sore knee. You're putting it right there. You're actually putting it here and it distributes for the rest throughout your body.
Correct.
Yeah.
Although an icy hot type of local effect is possible too. So that would be more like a salve or a cream that distributes locally.
Yeah.
And some of these other products that are more like a transdermal preparation.
That's what I was talking about.
They're what we call hydrophilic.
Okay.
Because cannabis is a lipid molecule, and it does not get absorbed anywhere beyond the very surface of the skin unless it's changed some way. Okay. Because a lipid molecule stays by the skin. If it's a hydrophilic, or it likes water, we say, it gets absorbed more deeply into the circulation.
I thank you for that. And how important are terpenes? I know we briefly spoke about terpenes in the last lesson, but how important are terpenes in treatment with dementia patients?
I think they're important. It depends on what you're trying to achieve. It's one of those therapeutic designs you can make. So, for example, if you're having a situation where insomnia is a problem, or agitation or restlessness at night, sundowning is a common term for what happens when patients with dementia become confused when the sun goes down. They become disoriented, they have trouble understanding time, and they become more frustrated, angry, sometimes even combative. So sundowning is a real problem. Myrcene is the terpenoid that you want to have when that happens, because myrcene can cause sedation. It also reduces pain. It enhances relaxation and can help that patient drift off to sleep in a calm fashion, as opposed to taking a medication like Seroquel.
Okay.
One of these other pharmaceutical agents that can cause confusion and lead to fall risk in elderly patients.
Can you share what else you can find myrcene in? I'm a big fan of these, so if you want to share with our group.
Do you have a mango tree?
I don't have a mango tree, but I always have mangoes, but I do love mangoes. And so it's calming. I know it makes me happy when I eat mangoes. So
we have a lot of those in Florida.
Do you have a lot?
Oh, I have patients that bring me bags of mangoes in season.
Yeah.
So yes, I enjoy them as well. And there is myrcene in mangoes. It's one of the terpenoids that cannabis and mangoes have in common. Cannabis has terpenoids in common with other foods because these are the aromatic molecules that give foods their aroma.
Can you talk on, before we move on, I know this is a little side note, but talk about, is it a myth or is it the truth that myrcene, mangoes, can intensify cannabis? Have you heard that?
I've heard it.
Yeah.
And I've heard Ethan Russo talk about that.
Okay.
And he thinks it's a myth.
Okay.
He talked about the theory that mangoes may increase the permeability of the blood-brain barrier, which is the barrier between the bloodstream and the nerve cells. And he's a smart guy.
Yes, he is.
And the way he described it, it sounds like a myth.
Okay.
Now, I'm sorry.
Yeah. I always say if something works, continue doing it.
I think it's fine.
Yeah. But I thank you for this topic here on treatments, and thank you to the Sacred Plant family for watching. Again, please join us for our live Q&As. If you have any questions whatsoever for Dr. Stein and myself, please submit them. We'll answer them live on the air. Again, if you're not if you're unable to attend our live Q&As, please still submit your questions. We will answer them on air, and you'll have access to everything that we're doing here in your patient's portal. So have a good evening. Bye-bye. We know it can be very difficult to watch our friends and loved ones transform overnight into victims of memory loss and malfunction of everyday executive functions. It is key that in order to slow progression, and in some cases halt completely, to have a well-rounded protocol. Medical cannabis is a powerful tool to have in your bag, but it works best when hand in hand with other natural health practices. In lesson number 5, Dr. Stein will dissect patient case studies to help those looking for solutions for themselves and their family members suffering from Alzheimer's and dementia, and act as a reminder of hope that there are positive results happening daily.